fact, isn't it? We did miss the boat on PPE, and in one case sent China almost 300,000 items of PPE. We are now reliant on China sending us PPE.
Well, first of all, in terms of PPE, we have, just to give some context, at the beginning of this crisis, we were just providing PPE for hospitals. That's 233 hospitals. We're now providing it to 58,000 different institutions, over 1 billion pieces of equipment. So there's been a huge ramping up. Now, it's true that at the beginning of the crisis, we gave some equipment to China. That was before it had hit us. It didn't take away from any of the stocks that we needed. And in contrast, we have had huge amounts more back from China. And indeed, we're expecting a further 25 million gowns coming from China later this week.
The trouble is, we are short, aren't we, currently, of gowns? We spoke to a palliative care doctor a little earlier on, Dr. Rachel Clark, who says she's pulled because the policy on gowns has been changed 3 times over the last month, and our standards are lower than the World Health Organisation's standards. Every professional within a metre of a patient who has COVID or suspected of having COVID should be wearing a surgical gown. Let's have a look at what she said.
According to the WHO, every single healthcare professional who is within a metre of patients, whether they have coronavirus or they're suspected of having it, should be wearing a surgical gown. That's not the NHS England advice. It's not the government's advice. And either we have mysterious, special, exemplary British science, or we're not following the best science because we haven't got the resources. And I just think the least we deserve from the government is honesty.
Oliver Dowden, you keep saying to us that you're following the science, but if we're not providing the gowns which the science says those healthcare professionals should be wearing, isn't it the actual truth that we're following the resources?
Well, the first thing we are doing is getting the resources. So, as I said, over 1 billion pieces, and we're working both nationally and internationally to get more equipment. This is not a challenge unique to the United Kingdom. In the global health crisis, of course, there's going to be huge demand for that equipment.
But Oliver Dowden, we had our first case here in the UK back in January. And in March, it was declared, the beginning of March, it was declared a global pandemic. And yet here we are heading towards the end of April, and we are still talking about trying to get the PPE. People do not understand why it is taking so long. And healthcare professionals are now having to make the choice about whether they treat patients because they're not properly protected. And we're losing too many healthcare professionals on the front line because they're becoming infected.
Well, first of all, on the point that you raised in your previous question that I didn't quite have an opportunity to address, that's the guidance issued on Friday. That is guidance based on clinical advice. That's clinical guidance. On the point about how much equipment we have, there has been a huge ramping up of equipment. Over 1 billion pieces, the number of institutions receiving it going from 233 to 58,000. Now, of course, there are challenges, and of course we are working through those. Just as there were challenges, for example, with ventilators, we've now ensured that throughout this, the number of ventilators is in excess of the need for it. We are working through all of these challenges in a crisis situation, but we are not unique in this challenge.
OK, but hang on a moment. On the gowns in particular, we know that there is now advice from the government that gowns can be reused. But that is not standard practice, is it? I mean, it says on the government website, these are exceptional circumstances and do not reflect HSE's standard approach. It is simply not true that you are following scientific advice. What's happening is that you do not have the resources to follow scientific advice.
Well, we are continuing to ramp up the resources. We've secured 25 million further gowns from China that will be coming later this week. What we did with that guidance was to deal with the situation in extremis, if those measures need to be taken. That was the clinical advice for doing so. But the government's singular effort working across all different aspects of the economy and internationally is to get as much equipment as we can. And
can I ask you, Oliver Dowden, how many people working in our health system and care home system have died so far?
It's 43.
It's not, though, is it? Because there's 80 people on this two-page spread in today's Daily Mail. There are 80 people they've listed who have died from coronavirus who are in the NHS or working in care homes. Why are you so grossly underestimating the scale of what is going on the front line?
Well, I'm using the most up-to-date figures that I have been given, and the figure that I was given this morning is the one that I quoted to you.
Right, but it's actually twice as many as you're saying. Do you know how many people have died in care homes from coronavirus?
Well, we have figures from the ONS that go back, which was 217, but of course the figure is much larger than that because there's a time lag with those.
Give me a ballpark.
Well, I'm not going to speculate on ballpark.
Well, officially, your position is 200 and how many?
217 was the ONS.
It's believed to be more than 7,500. So there's a bit of a gap between what the government would like people to think is happening, both in terms of the slaughter of our frontline staff and the reality. In fact, twice as many people have died on the front line of this as what the government is stating. And in terms of care homes, you say it's a couple of hundred, but actually it's believed to be, and this is the front page of a Daily Telegraph, a paper the Prime Minister used to work for, said it's nearer 7,500, and that was 3 days ago. Why don't you know? Why don't you even have a clue how many it is?
I have told you the figures that we currently have. Of course, there is a time lag in relation to non-hospital figures. So in hospitals, we get those figures out very rapidly, and that gives you a snapshot, and that's comparable with other countries around the world.
Do you not think you owe it to people working in hospitals and care homes on the front line? Do you not think you owe it to set up a system that every single day updates to this country how many have lost their lives in this battle, and indeed how many people, members of the public, are dying in our care homes? I find it utterly disgraceful that you're still saying it's just a couple of hundred when we know it's many, many thousands. These people are real people. They are real lives. Why haven't you got a system that properly accounts for what is going on?
Of course, these are real people and real lives. And I have the deepest sympathy for every single person affected. But as a government minister, I want to be able to give you facts that I know are true, and I've given those facts that I know are true. Now, in respect of how we get a more rapid information, we are working through how we get more rapid information. It's much easier in hospitals because when someone dies in hospital, you can make an instant diagnosis. In respect of what goes in the wider community, it takes longer. Now, we are working to get more rapid figures. I'm not saying the figure is as low as 217. I'm saying that is the latest figure I have. I accept the figure is likely to be much higher, but I don't think it would be responsible.
The reason it's significant is that if you add the declared number of deaths in our hospitals to the number that is believed to have died in care homes, that would make Britain the third worst country in the world for people who have died from coronavirus.